Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. We have another change coming. Another change is anticipated to hit the Federal Register no later than the end of this fiscal year, September 30th, 2024, according to the VA spokesperson. So I wanted to jump into it. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. The two asks are really, look, hit the thumbs up and let the video run. That is what helps to push this information out to more of us. Thank you so much. So jumping into it, the Undersecretary of Veterans Affairs for Health, Dr. Sharif Ellenhall, shared that the options officials were considering at a Society for Federal Health Professionals conference in February, that they are looking to see how they should deal with a specific ailment, and that ailment is called constrictive bronchiolitis. And there's currently no rating schedule for it. They utilize a different schedule. It does not have its own specific diagnostic code. And what Sharif Ellenhall, Dr. Sharif Ellenhall, has indicated is that the lawyers at the VA were trying to decide whether a newly created diagnostic code and rating schedule should be focused exclusively around constrictive bronchiolitis or an umbrella medical term called deployment-related respiratory disease, which would include constrictive bronchiolitis and other respiratory conditions. Now, another piece here that talks about the time frame is the VA aims to publish the revised changes in the Federal Registry by September 30th, 2024, which is the end of the current fiscal year, according to Capitol Hill staffer and a health professional with knowledge of discussions on this issue. Now, this is really important because what happens when we have new rating schedules, right? Sure, people are getting awarded and being service connected for this condition currently, but what are they being rated at? According to this article, many of them are at 0%. So if there's a new rating schedule that gets created, what are we looking at? We could potentially be looking at a higher rating schedule or cascading ratings depending on the severity and situation. This specific ailment, constrictive bronchiolitis, is very difficult to diagnose. You must have a biopsy, an intrusive lung biopsy, to really dive into it and figure out if you actually have that. According to the article, it says that there are an estimated 300 to 400 veterans who have been diagnosed with constrictive bronchiolitis or other small airway injuries after receiving lung biopsies, according to a VA staffer who has worked extensively on this issue. That estimate pales in comparison to the number of veterans with other more common respiratory conditions. For example, as of January 1st, 2024, more than 7,000 veterans had claims approved for chronic obstructive pulmonary disease, COPD. More than 30,000 claims for asthma were approved. But unlike asthma and other pulmonary conditions, CB, which is the constrictive bronchiolitis, cannot be diagnosed with a traditional lung test, such as an X-ray or CT scans or pulmonary function tests, PFTs. A confirmed diagnosis requires an invasive lung biopsy, a test that can present significant costs and risks to the patient. The NewsHour has requested updated VA data on how many veterans have been diagnosed with CB, but has not received it. And I'm not sure what they mean by received it. Maybe they mean service connection. Former VA doctor, I think it could be Alan, I'm not sure. Alan Harris says that the 300 to 400 number is a huge underestimation, which means that the difficult path to diagnosis and benefits is likely felt more widely. I bet it's 10 times what has been officially diagnosed, she says. Veterans with CB experience severe shortness of breath and fatigue when exercising, but most people are told that their issues are asthma, or are told there is nothing wrong with them when they clearly have symptoms, said Harris, who served as a pulmonary doctor at the Jackson VA Medical Center in Mississippi from 2014 to 2018. I find myself struggling when I pull into a parking lot, even at the grocery store, because I know what's going to happen. Former Army Sergeant Cynthia Amen, who served in Kuwait and Iraq in 2003 with the Missouri National Guard, told NewsHour in 2018, if I have to park in the back of the parking lot, by the time I get inside, I'm so winded, it's miserable for me to even get my grocery shopping done. It's a challenging diagnosis, Dr. Harris explained. She said during her time at the VA, she started a clinic for Iraq and Afghanistan war veterans who experienced unexplained shortness of breath. Patients would get to my clinic and say they have been asking to see pulmonary for years and couldn't get a referral because their tests were normal. Harris told the NewsHour she asked primary care clinics to refer to her any veterans who had new onset of cough or shortness of breath since deployment. With that change, she began seeing more and more veterans, several hundred overall, with unexplained shortness of breath. It was overwhelming how many there were, and that was just in Mississippi. One of the many who came in, about 5 veterans she saw decided to get lung biopsies. They were all positive for CB, she said. Dr. Robert Miller, a professor of medicine at Vanderbilt University Medical Center, points to a Defense Department funding study that reflects how widespread the condition is and how difficult a diagnosis can be. It found that 380 service personnel who had shortness of breath while exercising and had deployed to Southwest Asia for at least 6 months, 32% were undiagnosed after undergoing a battery of tests. None of them got lung biopsies. The VA defended its process for disability benefits for CB. A spokesperson told the NewsHour by email that the lack of a dedicated diagnostic code for constrictive bronchiolitis has not significantly affected the awarding of disability compensation. Then there's a quotation here. While there is no specific code for constrictive bronchiolitis, this does not impact the benefits we provide, the spokesperson wrote. I'll just throw out there then, what we see when there's changes to diagnostic codes or the adding of a diagnostic code in a condition and a new rating schedule assigned, we'll use GERD for the example. GERD's maximum is 60%. They've added a diagnostic code. They changed the rating schedule mirroring esophageal stricture, and now the maximum is 80%. So that would be an effect for somebody, right? So I don't know how they can say that when they're talking about making changes to adding of a diagnostic code and the potential of either having its own rating schedule or a umbrella rating schedule that incorporates this. I would imagine that the rating schedule might be different. So with that, thank you so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.